Thanks, Minister. So obviously the situation in Greater Sydney continues to evolve. There's been an update from the Premier and Chief Health Officer there this morning. Additional cases overnight, as you know, 42 is the total number of cases, including the case that's in Queensland associated with the Northern Beaches cluster. There will be further cases through the course of today, as has been flagged at that morning press conference. We need to check in on what those updates will mean for us. Really, it's a question of how concentrated those cases are in the Northern Beaches area. There are new restrictions that are now mandated for the Northern Beaches. That will obviously help to control transmission there, but cases may well be outside of that greater Northern Beaches area. So if that's the case, we'll need to review that. We'll need to see what settings they might have been in, how many people might have been exposed, and therefore what the risk is in the Greater Sydney area as it applies to our current orange zone and the permit scheme. If there is transmission in the Greater Sydney area, we obviously need to reflect on that, and as the Minister has indicated, what that might mean for a permit scheme or a prohibition of people coming from Greater Sydney. But at the moment, it's very strongly concentrated in the Northern Beaches area in Sydney. That's a good thing in terms of managing transmission. But in recent days, people have moved about a great deal, and that may well mean that there are some settings outside of that area where other individuals have been exposed. Not everyone with COVID-19 is infectious, and so people can go to some of these so-called exposure sites and no further cases occur. But if someone's infectious and they've been to a place with a great number of other people, then you can certainly see spread outside of those settings. So we just really need to follow that moment to moment and make a judgment through the course of today and the rest of the week.
Would it be fair to characterise the situation as you would expect if we need to move to putting Greater Sydney as the red zone, that would happen likely in the next 24 to 48 hours, pretty quickly?
I think we'd consider it at any point into the future. At the moment, it really does depend on those day-by-day numbers. Yes, it's in consideration, it's in play over the next 24, 48 hours, absolutely. But if it stabilises and then goes awry later, it's still a consideration. It'll always be a consideration. But we're watching extremely closely over this next 24, 48-hour period for sure.
And what about the rest of the state? Do you think it's unlikely that the whole of New South Wales would close the border to the whole of New South Wales? Well,
I think if that's felt to be a requirement, yes, we would. The reality is Greater Sydney went through months and months of low-level transmission, including up to 10, 15 cases average per day, without significant seeding into regional New South Wales. So that's worth reflecting on. But it's also absolutely the case that over the Christmas period, people will be moving into regional New South Wales more than they might have 3 months, 6 months ago. So we have to bear that in mind. If there were any cases in regional Victoria, we'd review on that basis as well. And if we have to make a hard border at the border, we'll do that.
How are you feeling? I think everyone in Victoria had a collective sense of relief, and now it's almost, we were discussing, it's like we've got a bit of post-traumatic stress. How are you feeling having to go into this again just before Christmas?
Nobody wants this to be the case in Australia. Nobody. Certainly not Sydney and Victoria. Having made the enormous sacrifices we have made, there's no question that we want to be as precautionary as we possibly can be. It's also a reality that our border communities have actually been hit as hard as anyone in Victoria, economically, financially, in terms of work and the constraints that have been placed on them. So we need to have a consideration about what the actual risk is just across the border in New South Wales, and regional New South Wales is not anything more than a negligible risk at the moment, I think. But we do have to consider protecting the status of Victoria as COVID-free in terms of community transmission, and we'll be appropriately anxious about that, because we don't want seeding into Victoria, and of course we've got in mind everything that we've been through over months.
Could we have cases here already? That's what people are
I think it's unlikely. There's one case per 10,000 people in the Northern Beaches. You know, it's a population of 250,000 people. Many thousands are stepping up for testing in that area right now. So I think, you know, especially those who are symptomatic, but even those who are not, are being tested. And so, you know, that's terrific in terms of finding out where cases are. And obviously, their close contacts are being quarantined, and we'll watch that very closely. So you know, the risk is there, but I think it's very low. And obviously, we're placing strong obligations on people not to come. They will go into mandatory quarantine if they arrive here from the Northern Beaches or other hot spot areas. But also there are penalties that can apply. There are fines up to $1,600. There are penalties up to $9,000+. So those are also available for people coming in on flights or crossing a land border without a permit.
Is there any consideration to implementing some minor precautionary measures, such as masks, wearing masks again in pubs and restaurants or something like that?
Look, in pubs and restaurants, it's less of an issue because people take them off to eat and drink. We've talked about it in indoor places that are highest risk, and I think that's in place in Victoria. It's the only place until today in Northern Beaches where masks have been mandated, and you know, it applies to large shopping areas. I think there's still a very strong culture in Victoria of wearing masks when you can't physically distance. I think that'll continue to be the case, and that's a great insurance policy. We've also introduced from midnight tonight a requirement to wear masks mandatorily in airports, domestic or international. So that'll also be in place, and I think that's another risk mitigation.
So it wasn't mandated before? We were a bit confused.
Not for airports, no.
I think Melbourne Airport has its own policy. Were you disappointed to see the number of people at the airport today coming in from Sydney despite the warning yesterday?
I understand that people are trying to get home. You know, these are people who've probably left. Clearly they shouldn't be coming from the Northern Beaches area. They're all being individually assessed, and I think that's a strong check by our authorised officers for each and every person who's arriving. I understand that people were wanting to get home. Of course, we're going to continue to strongly recommend all of those individuals to get tested if they're from the orange zone of Greater Sydney. But you know, it's understandable that people are wanting to get home again.
Do you fear that while people have been mostly compliant with the rules throughout the year, because we're at the time we are, people want to reunite with family for Christmas, they're also over it because of the year, do you fear that this might be the time when people don't do what they're told as well as they were?
I think Victorians are probably the most compliant, having been through everything we've been through. Christmas is a time for catching up with people. Again, I'd really recommend that you know, people who've come from that Greater Sydney area are getting tested regardless of symptoms. And if you're symptomatic, you really can't be seeing relatives. You're putting them at risk, and nobody in Victoria wants that to occur. So I think overwhelmingly Victorians will do the right thing. We've got you know, we've got antennae for this more than anywhere else in Australia.
I guess my question before was, sort of more broadly, it was around, is there any consideration of implementing more precautionary measures here in Victoria? I use masks as an example, but is there any other thought to increasing that sort of level of safety? You know?
Well, I don't think so, not at this stage. We'll consider it as we need to, but the focus is on where the risk is. The risk is in Sydney, in the Northern Beaches area. That's where we're placing our mitigations at the moment. You know, if there were anything to consider, because we think that risk has been imported into Victoria, yes, we'd review that. But Victorians are, as I say, you know, pretty alive to this risk, and they do the right thing in terms of their individual behaviours, and the rest of the settings are really that balance of the insurance that you want by not having, you know, unlimited crowds indoors, and you know, continuing to have caps for events, continuing to have the density quotient in place, but they're proportionate measures at the moment, I think.
The aircrew member who has tested positive, are we confident, comfortable that that person had been quarantined properly, that they hadn't left their hotel room? Because obviously it's before the new measures which came in place, as we say. Yeah,
we are. That said, we're always alive to, you know, needing to review each and every case that might arise in aircrew. The testing program in Victoria, again, strongest in Australia. If we identify further cases, we'll go through the same process of a detailed interview. You know, it's usually only other aircrew who are potential contacts. Everyone else who's interacting with them is maintaining that distance, wearing PPE, including those hotel staff.
And the Australian Open was announced today that players are going to be able to come. They have to go quarantine, but they are allowed out for 5 hours a day to train. What assurances can you give Victorians that that's safe?
They're very strict requirements. You know, clearly it's a balancing act in terms of maintaining those training requirements for the players, but they are again separated. There's bubbles within the cohorts in the hotels. There are quarantine requirements for the physiotherapists who need to attend to them. All of the time that they're spent training is observed to make sure that they're not mixing, and the few close contacts that they have in those bubbles become the close contacts if anyone tests positive, and they all get mandatory quarantine as a result, and obviously can't be part of the competition. So they're very strict rules. We've worked them through in very fine detail with Tennis Australia, and it's all been agreed to. So I think, you know, we're managing a pretty tricky situation in terms of the requirements of the players to be able to train, but we are not cutting any corners in terms of managing that risk of transmission.
Are you worried that they come through Sydney? Some of those players will come through Sydney. Is that a concern?
No, I don't think so. You know, they'll come through without mixing with the general Sydney population, and then they'll be straight into quarantine in Melbourne for that 14-day period, and they won't be playing that competition until there's a completion of that quarantine. And so at the point that they're involved in the competition, they won't be a risk to anyone.
Isolation and air crews and the enforcement of that isolation seemed a little bit fluid in the last 24, 48 hours in the wake of all this. Where have we landed with that?
Certainly we're consolidating the accommodation for airline crew. They're going to be concentrated in a specific hotel. The application of infection prevention and control guidelines will be strengthened. The compliance and enforcement oversight will be strengthened. And we've got a testing program that's going to apply to those crew as well. And we've identified someone by virtue of the testing program being introduced. So I think all of those are additional measures that will make it safer.
So will police be watching that? Like police will
so look, it's not the COVID quarantine Victoria mandatory quarantine process. It's not the same with floor by floor monitoring. These are air crew who are really spending their entire lives working and quarantining, and so they need to be able to manage that in a way that is sustainable for them. That applies in New Zealand, it applies across Australia, but we are assured by the airlines that they are following those procedures strictly, and there is another level of enforcement whereby, you know, anyone who's breaking the rules will not be allowed to be part of flying if they can't be trusted. But every indication I've got is that they're trying to do absolutely the right thing and are doing the right thing. That doesn't mean the risk is zero for internationally based crew in particular.
Yeah, it seems like a real soft spot, doesn't it? Like, I know Victoria, we're new to this again, but how is this not being sort of looked at and covered at like elsewhere in Australia?
Look, it's always been covered. There was a balancing act again, because this is an essential service in order to get Australians back home, for example. And so the international air crew haven't been able to be watched from Victoria when they're on their international duties. So we have to try and mitigate the risk for them in their home countries while they're in Australia to the fullest extent possible. And we've always gone through a review process. We've talked about it at AHPPC, where all Chief Health Officers come together to discuss it. And these are some of the additional measures that we're reflecting on now that we're really in a state of no community transmission. That's appropriate.
And can I just one more sort of numbers thing. You mentioned the unaccompanied minors this morning. Are there any other people from the red zone quarantine at the moment?
Yes, there are. Just a couple. I think there's only two who are known close contacts of cases who've identified themselves, either in response to the text message or calling our hotline, and who are quarantining appropriately.
So the 2 plus the 2 unaccompanied minors?
That's right.
So we-
And
The
the
two are
family,
already here.
Yeah.
right, and the family of the minors, I assume, will have to cover the cost of that.
No, that's an international quarantine arrangement only under law.
Mum was already here, or the carer.
But now all 3 of them are in mandatory quarantine,
Yeah.
so who pays for that?
But I don't think it applies for domestic quarantine arrivals.
So Victorian taxpayers are going to have to cover the cost of their quarantine.
For that family, that's my understanding.
So, will you want to clarify, or can someone come back to us with the exact numbers on?
Yeah, I'm sure we can.
So,
Yeah. Yes.
I've got another question for Mr. Fole,
Sure.
just on a few other than that. I'll just